very difficult treatment process that included awful side effects. He is also an author, and he's published a book called The Mystery of God's Will. Thank you all. My name is Iman Kishore. I came from Addis Ababa, Ethiopia, and I was an MDR patient. I don't know how many of you know about MDR TB. It's a unique type of TB. It's more lethal and it takes you too much time to cure. It takes too much expensive amount of money. And I'm very delightful to share my life with you because it encourages you more. And in the year 2003, I've got a chance to join university as a pharmacy student in Jimma University. That's a great privilege for a children like me to join university and have got to get a good job. And meanwhile, I've got a TB symptom, lose my weight loss and many symptoms. But I just go to campus clinic and I've got tested. I am positive for TB and I started my medication. Even though I took my medication for probably more than 8 months, and we didn't see any physical enhancement. Rather, the symptom becomes more severe, so that we are forced to continue the medication because there is no way to discontinue the medication. So that for another 8 months, I took the medication. We just waited for second-line anti-TB medication, which is more effective than the first. So the second-line medication was too much expensive, and it may cost you about 2,000 USD dollar. Even a man from America cannot afford this price. So that we are waiting, my family, friends, and my doctor waiting for my days because we can't afford the price. Meanwhile, I've got a chance to get the medication because of the generous support of some people from America, Colorado Springs. I just want to thank them because they are an important part of my life because they saved my life. And today, Mr. Osman family saved the life of one man. Now today, we save the lives of many MDR patients in Africa. So I want to say thank you, and I want to encourage their commitment and generosity. Meanwhile, and when I took the medication, it took a long time. I took it for 23 months, and it was so toxic. But I have to stick with the medication because saving life is the best than the side effects. So I took the medication, and with all the side effects are severe, and there are many side effects like psychosis, psychosis, and constipation, and we start 5 of them second-line medication. 3 of them commit suicide because of the side effects and their second-line medication. And then after I get the medication, they are more effective so that I can cure from the disease, so that I've got the chance to back to school and graduated from pharmacy school. And now I'm advocate for we publish another pharmacy in our country. It's the first. We educate the public by giving informative information about TB and any other medical issues, so that I can revenge what immediately bestowed on me. And I want to thank the one who committed their life to save the life of your children. I want to say thank you. And on the way now, I've got a second chance because of the second anti-TB medication. And
Texas. At the age of 36, Rachel began experiencing symptoms of TB, but wasn't properly diagnosed for a number of years. Around the same time, her 3-year-old niece was diagnosed with TB, and Rachel is currently involved in a variety of advocacy efforts in South Texas and along the border. After Rachel speaks, we'll go into a question and answer session. Rachel.
Hello, everyone. I'm very honored to be representing millions of people affected by TB that are voiceless. One of the main points that I want to make is that I usually do not refer to myself as a patient or a former patient because I believe I was way too patient for 3 years of misdiagnosis. So I choose to call myself a TB survivor. And more so, a person affected by TB. And by the end of my talk, and by the end of all of our presentations, I hope that all of you will equally be persons affected by TB in order to be motivated to take action. Just as TB is infectious, the cure and the way to solve this problem, the way to eliminate TB is also infecting others to do their part. Okay. My story started when, as a child, I was infected by TB from relatives who had TB. Later on, I had a positive PPD test when I immigrated to this country in '71. But my chest x-ray was clear. In 1990, I had a positive PPD when I applied for a government job, but again, the chest x-ray was clear. Later on, in 2002, I was diagnosed with diabetes. And within months of that diagnosis, I started developing the active TB symptoms of coughing, night sweats, weight loss, which my doctors thought was a great thing. Being diabetic, losing 45 pounds was good. But coughing, I got diagnosed with sinusitis, bronchitis, laryngitis, all the itises that you can think of, asthma. And medication for asthma was very expensive and yet not effective. During those 3 years, as David was saying, my niece was also going through her own ordeal of a cyst on the top of her left foot that kept recurring. It kept coming back, and every time they removed it, it took a few months for it to come back. Finally, before having the third surgery to remove that cyst, we were all tested. I was diagnosed. They had my family members, 7 of them, turned out to need the preventative medication. And in my niece's case, she had to have a daily dosing of crushed pills. And so for me, it was torture to have to administer that medication. If any of you have kids, young people in your families, when they get sick, how hard is it to give them the medication? For a 10-day dose of antibiotics, imagine 9 months of it. Daily medication that makes her sick before it gets her better. It had a lot of side effects on her. From being a very active child, she turned into a moody, sad, reclusive, and very afraid of going to the doctor. And for 9 months, she was, in a way, a reminder for me of how I had caused it. I felt sick, ashamed, and guilty. And more than the physical effects of my own TB symptoms, seeing her suffer made me, like I said, guilty and ashamed, but also very angry at medical professionals who had seen me for 3 years, diagnosed and misdiagnosed and mistreated, and allowed me to infect maybe 15 people every one of those 3 years. As a school teacher, like I said, I unfortunately may have infected a lot of kids, a lot of young people. And so one of the big motivators for me here is to make amends for for what I may have caused. But also, like I said, to recruit soldiers, to recruit people like you, who can, from your own trenches, do something about it. I would like to motivate people to build partnerships, to take action. And one of the very first things that we're doing here right now that is a very big step is to talk about it. Many of us in our respective countries and in the cultures that we live in, as a Mexican American, talking about this disease was trying to break down a big barrier of stigma because you just don't talk about it. Because it's a death sentence most often, and also because you get judged by people in a way like, what did you do to bring this on? Is it because you hung around the wrong crowd? Is it because of lack of hygiene? And because I was in contact with so many groups of people, all my environments were affected. My school, my friends, my community, my church, everybody had to be tested. And there were some people that were very reluctant, saying, no, I don't want to be tested because I'm not like those people. And it happens that there's a lot of misconceptions of what those people are. And it's them, it's me, it could be you. Like Andre was saying, the air is shared by everybody. And because we've had it, you could get it, we could get it again. We can be infected. There's no, we don't build immunity to it. So by helping us to spread the word instead of the disease, you're protecting yourselves, your loved ones, which is what I tell people when they're not wanting to get tested or not wanting to continue the medication despite the side effects. I tell them, you're doing this not only to stop TB within you, within your body, but you're also helping to protect those around you. And like it's been said and repeated, it's a global issue, but it has very local ramifications. And it's got a tremendous impact on future generations. Think of any one of your kids, any one of them were to get a disease that is treatable, that is preventable, first of all, and treatable. You would not expect that child to die, and yet around the world, 200 kids die every day. 9.7 million orphans every year are left behind because of parents who died of this preventable and curable disease. So my point and my purpose here is to have you be effective. Make those connections. This isn't something that happens around the world. It is a plane ride away, and your speaker proved that anyone can get to me. I would like to I'm hoping that you can move out of here afterwards and start talking about it. Break down this culture of silence that promotes TB transmission, that allows for deaths that are, as one senator, as one congressman put it, a sin. We have the means to stop these deaths. We have the means to eliminate TB, and yet we're not doing it. So I'd like to unite your goodwill, the goodwill of so many other field soldiers that we can recruit to end the fight against TB. We have the means. Let's incorporate the way. Let's partner and take action. Thank you.
I want to thank all of you again for speaking before we get into Q&A. It took an enormous amount of strength to get through what you all experienced, and it's taken even more courage, I think, to deal with the issues of stigma and the lack of education, and to come forward and tell your stories in such a public way. So thank you very much. We're going to move into question and answer, and you're all welcome to ask as many questions as you like. I'm going to ask the first question, and then I'll turn it over to you all. And everyone can answer these questions. each of you talked about a variety of issues and obstacles concerning TB in your communities. In each of your individual communities, what do you see as the largest obstacle or the first most pressing issue that needs to be dealt with to help combat this problem?
Thank you so much for that question. I think what I would say that is one of the barriers or rather causing a lot of problem in the community is actually lack of information. Community needs education about TB. TB has actually been left like it's a big problem. It's a medical, many times in Africa, TB treatment is actually, doctors are normally waiting for patients to go to the clinic or to the hospitals. And therefore, the cases that reaches to the treatment level are actually cases that are already very bad cases. People seek medication when it is too late. So our health-seeking behavior back in Africa is very bad. And therefore, you realize that some people are lost in between because there's no opportunity to do proper diagnosis to establish whether it's TB or not. So now, more so in TB cases, and especially people who are infected, they are lost because of that lack of education. We need serious commitment in terms of disseminating information on how TB can be treated, how it can be prevented, and how it actually can be diagnosed. Because early diagnosis really will save a lot of things. First, it will save the life of a person who is infected, and secondly, it will save the community because of the transmission of the disease to the family and to other contact people. So we need to put in a lot of education in communities.
To add some more, in my country, there are MDR patients who are waiting for second-line anti-TB medication. They have a waiting list for the medication. As I told you, the disease is too severe and later. In the meanwhile, in the midst of waiting the medication, they will die, many of them. So that more fund and more support and commitment to supply enough medication and full health care system need to be established so that your support, maybe developed country support, must have to be increased so that they can get the medication properly and
Just to add to what was said now, I think awareness that needs to be created. So, because prevention is better than cure, and the one way that we can prevent the further spread of TB, and obviously the others, is if people can prevent it by getting to equip themselves on the facts. If people know the facts, then we will not have the stigma, and we will give the needed support to the others. And if people know the facts, then people will definitely know, okay, I have to complete my treatment. And just on my way here, unfortunately, last Saturday, the 17th, I had to bury an uncle of mine who lost his life due to TB. He was on treatment. He didn't complete the treatment. And so you can imagine it's another loss and it becomes another problem. So awareness is something that we need to do. We need to have a debate and dialogue continues. Dialogue on this.
Another thing is partnerships and communication between departments, health departments especially. HIV needs to communicate with TB department. Diabetes needs to know that the patients there are more at risk because of their compromised immune system. And more support, I think. The person affected, person going through treatment, there's a lot of psychological effects of depression, of isolation. Part of the treatment is your quarantine. You are cut off from friends, family, right at the beginning. If that can be complemented by other things like support, religious support, social support, for some people, they do not stick with the treatment because of the bad side effects. or because they have quarantine, it requires that they not go to work and they lose their jobs. So economically, socially, psychologically, all of the person, the whole person gets impacted. It's not just the physical symptoms that need to be treated. Thank you.
Okay, for me is, you know, we really keep it secret. It's like only in our family because we were too scared to tell people, friends and family that she had TB, but actually she's not contagious. After having the experience in the hospital with the nurses which have more medical knowledge about it, and after that we experienced, I was like, how about outside this hospital? How much more those people who don't know about TB, how they gonna accept it? So that's the most thing I was really, really scared, is how the school, her school, the community gonna accept us, you know. That's really hit me the most. And the second one is, if when she was 5 years old, if I was educated about TB, she can be, you know, treated earlier.
In my opinion, the one more obstacle is that the long treatment with many drugs and come along with many side effects that make the patient feel really tired and disheartened. And I do experience this feeling, and there's many people quit the treatment in the middle because of this. So I hope that in the future we will find new treatment, new method, which is shorter and decrease the amount of drugs, the amount of injection. That's really help. Thank you.
So we have microphones that will come to you if you have a question, and if you have a question, just raise your hand and the microphone will arrive. Up here at the front.
David Bryden with Results and the South TV Partnership. I just want to thank everyone on the panel for lending your voices to this really critical issue, and for USAID and all the other partners that help make this event a reality, and David as well. You know, on World AIDS Day, December 1st, President Obama made a very important statement of the commitment of the U.S. government and of his presidency on HIV/AIDS, following in the example of President Bush, in fact, and really helping to raise awareness about this and make clear the commitment of the U.S. government. So we'll see what happens on World TB Day coming up in just a few days, and we're hoping that we'll see something similar. But I wanted to ask maybe the panelists, and maybe Rosalie could comment on this. If you could imagine, if you had just a few minutes with the President of the United States, what would you ask of him, or what would you say to him in terms of his presidency? What would you say if you had a moment in the White House?
I will tell him that every kid have the right to have a healthy life. I don't want children experience what my daughter experienced, the 5 years that she lost. I feel that the TV control her, control us, the family, and if he can give more support on TV and raise awareness or find a better medicine, you know, a better treatment. Because when I see my daughter on the first 2 months taking, I believe, 14 pills a day, and her stomach gets sick, it really, I'm the one really getting more sick, seeing your child.
There are other panelists that want to respond?
From my side, what I can just add to that is America has been on the forefront in terms of giving support and helping, and thankful because of this support and this help that has been given that we can be testimony and others can also be alive today. And we know that obviously, probably due to the current challenges, then cases like TB becomes probably secondary and such. But then again, TB is something that is coming a long way, and it's overpassing also the new diseases. So TB is something that really we should not, by all means, we should not, how should I say, cut back on whatever support that TB that is probably given to TB, because we need better medicine, as she said earlier on, because sometimes even once it gets to the second stage, then, and I've been speaking to my colleagues here, they've also mentioned that people, it's become so severe that even sometimes people cannot continue with the medication, that they end up even committing suicide because it's very, very difficult. So if we can find better medicine and vaccine, then I'm sure it's going to help us. So we would like to call on the people of the United States of America to continue giving the necessary support.
I would keep it short and simple and say a child's medication to prevent him from getting TB is 3 cents a day. A total treatment for a person who has developed the TB disease is $25 total. Look at the numbers, and why deny or why let the disease run its course without treatment if it is such a cheap investment? Great returns on the money, and it is the humane thing to do to ensure that children live the lives that they deserve, the quality of life that improves, and it is our future. I mean, the Stop TB Partnership and the World TB Day motto is Stop TB in our lifetime. We can do that. Let's put our hands in there, and all of us be soldiers on the program and do as much as we can from our trenches.
Any other questions? Can we get the microphone up in front?
Thank you again so much for sharing your stories. You guys are so brave and so inspiring. So few people who've experienced TB personally choose to stand up in front of a crowd and talk about their experiences. How can we encourage more people who've experienced TB directly to share their stories and to become advocates for this work?
I think for me now, this is our first time, to speak up. Just speak up and tell everybody what you experienced. I'm sorry I'm too emotional, but if you're not gonna speak up, when it's gonna stop? So if I want to help another parent or family, I need to start speaking up.
I would say one of the things that will actually make people come out and speak about themselves is the fact that the impact that their speech will do into making sure that everyone does not die of TB. If we call for more investment, more attention from the national governments, development partners, I think more people speak about their stories. The other thing is stigma associated with TB. Because in many countries, like for example where I come from, a TB patient is automatically seen like having HIV. TB is associated with HIV, the sign between the two diseases escalates into stigma and discrimination of people with TB, and therefore this hinders them from coming out. We need to fight stigma that's a barrier to access to treatment and services.
Thank you. As a pharmacist, I can share, the medication information, the drug. I can tell them but because I was a media TV patient, now I'm not maybe share my, the ground information, but I can share my life so that I can share their suffering. So that's something that I can summarize also.
I've spoken with several support groups for persons affected by TB, and many of us come to the conclusion that without us at the party, there is no party. If there were no person affected by TB, we would need those nurses, we would need that medication, we would need your help. Please include us, and please encourage the person that you are dealing with, that you are treating, to become a partner, become the central, the person that you are moving for, acting for, and it is because of us. So if we're not there, it's our party, but we're not invited.
Actually, in my country, they don't mention much about TV every day. And but when I come here and see you guys say interest to care about TV, that's what encouraged me so much, and I was really inspired. So I hope that you guys can continue doing this thing, and TV needs to be counseled more.
Several people have mentioned stigma. What are some of the ways that you have, or have you personally experienced stigma, and what are some of the ways that that has shown itself? And why do you think there's such stigma related to TB? What can be done about it?
Yeah, like in my case, for example, I experienced stigma. I teach in a college in a hotel school, teaching management and entrepreneurship. My background is a master's in business administration. Therefore, I have an opportunity to be in a college where we eat together, all the staff and students. But from my story, when I was talking about the way I was physically, everybody would be scared of me. And not in the cough, leave alone the cough aside, but the way I was looking, they were looking at me, it was definitely that this is evident. I had not disclosed my symptoms, but they could just look at me and say, no, this is going. He's an HIV person, and therefore, people could even move away from where, for example, when I come and get them seated and eating, I come to eat with them, they just leave and go sit in other spaces. Generally what happens is that the people, the community, or rather the society or workplace where people work, people don't have enough information. You don't have to discriminate somebody simply because of his or her health condition. We all know that HIV cannot be transmitted through sharing of utensils, sharing of toilets, sharing of air, and therefore we don't have to discriminate somebody because of HIV status. Likewise to TB. A TB patient, after this knowledge could reach everyone else there, that after medication, or rather when somebody is on treatment for 2 weeks, this person should not be, is not contagious, and therefore you don't have to fear this individual that will probably affect you. So what perpetuates, or rather accelerates the rate of stigma is lack of knowledge. People need to know at what stage is someone infectious, and at what stage is this person not infectious. So that's why I say that TB has actually been a medical thing. It has been medicalized in that the information is only contained at the hospital, but the community don't have enough information. And where do people live? They live in the community. So basically, we need to know the truth. At what stage is a person contagious that can actually affect other people, so that we eradicate discrimination. The other thing that mechanism that can help us eradicate stigma and discrimination is actually talking about TB. Like for example, some of us who have actually undergone the treatment, we come and talk to people in schools, in colleges, in churches, everywhere, and let people know. Like for example, what we are doing now in Kenya Rehabilitation, we are giving a health talk in clinics, where we take 5-10 minutes just to talk about TB for patients who have come with different kind of ailments. But when they are there at the waiting bay, we talk about TB. We talk about TB in the public rallies, public barazas, those administrative meetings, so that at least people understand about TB. So it's all about talking about TB that can actually reduce the amount of TB discrimination.
Some people in Africa talk about TB. TB is a disease of poor people, so that nobody appreciates when you have nothing, so that say intentionally discriminate, intentionally separate you. When I was in campus, we had a goal to share with 12 students, and when I just coughing and spitting, they just leave that room, so that I have to go back to home in order to just say it's once based on 11 people, so that I just come back to home. So as they say, we have to encourage them, so how can they prevent themselves, officially, it's a polite way to prevent themselves, so that the main problem maybe, as they say, is lack of awareness and prevention.
Simple. Because me, myself, I